welcome to The Explainer. Today we're tackling a really important topic, cervical cancer. It affects hundreds of thousands of women every year. But here's the thing, unlike so many other cancers, this is one we actually know how to prevent. We might even be able to eliminate it entirely. So let's get into it.
All right, here's how we're going to break it down. First, we'll look at the sheer scale of the problem globally. Then we'll get into the virus that's behind almost all of it. We'll see how it develops. And then, this is the important part, we'll explore the incredible tools we have to screen for it, treat it, and even prevent it from ever starting.
Okay, first up, just how big of a deal is this? Well, when you look at the global picture, the numbers are pretty staggering. Get this, it's the fourth most common cancer for women worldwide. The fourth. That puts it in the same league as some of the cancers we hear about all the time, but for some reason, this one just doesn't get the same attention. And that leads to a huge number of deaths. We're talking about 350,000 every single year. But here's what's absolutely crucial to understand. The vast majority of these deaths, they're happening in lower-income countries, places that just don't have access to the screening and prevention tools we're going to talk about in a minute. So what's causing all this? What's the main driver behind those numbers? Well, it turns out science has a very clear answer on this one.
Yeah, just look at this. It's almost unbelievable how dominant one single cause is. A staggering 99%, basically all cervical cancer cases are caused by a persistent infection with something called the Human Papillomavirus, or HPV. You just don't see a cause and effect link this clear in almost any other area of cancer research. It's amazing, really. Now, HPV itself is super common. A lot of people will get it at some point in their lives. But, and this is the key, it's only a few specific high-risk types, especially types 16 and 18, that are the real culprits. They're the ones that can cause the kinds of changes in cells that eventually, over time, lead to cancer. Okay, so what about other things, like smoking or having a weaker immune system? Well, yeah, they can definitely increase the risk, but you have to think of them as secondary factors. They might make you more vulnerable, but the bottom line is, without that underlying high-risk HPV infection, the main trigger just isn't there.
So how does this happen? How does a common virus actually turn into cancer? Well, it's definitely not something that happens overnight. Think of it more like a slow-motion invasion that takes years. The virus is basically like a tiny biological hijacker. It has these proteins, E6 and E7, and their whole job is to find and shut down the cell's natural safety brakes. The tumor suppressors that are supposed to stop cells from growing out of control. Once those brakes are cut, the cell just starts multiplying like crazy. And here's maybe the most important point of this whole explainer. This is a really slow process. From the moment of that first HPV infection all the way to invasive cancer, that can take 10, 15, even 20 years. And that huge timeline, that's not a bad thing. Actually, it's our biggest advantage. It gives us this massive window of opportunity to find it and stop it in its tracks. Right. And that long timeline is exactly why screening is such a game changer here. It's one of the most powerful tools we have. And the goal isn't really to find cancer. The goal is to find the potential for cancer, way before it becomes a real threat. This is such a critical mind shift. When you get a pap smear or an HPV test, it's not a test for cancer, it's a test to prevent cancer. It's designed to spot those early precancerous changes in the cells, long before they'd ever have a chance to turn into something dangerous. And the process is really logical and systematic. So step 1, a routine screening test might flag a potential issue. If it does, step 2 is a colposcopy, which is basically just a closer look with a special microscope. And if that still shows something abnormal, step 3 is a biopsy, where a tiny sample is taken to get a definitive answer. Okay, so what happens if they do find something? Either those precancerous cells or maybe even a very early stage cancer. Well, here's the good news. The treatments are incredibly effective, especially when you catch it early. And the treatment really depends on the stage of the disease. If it's caught at the earliest stage, a pretty simple procedure might be all that's needed. But you can see, as it advances, the treatments have to get more aggressive, often involving surgery, radiation, and chemotherapy. Which brings us to the main takeaway here. This isn't a story about a disease you can't avoid. It's the complete opposite. It's a story about prevention and about the very real possibility of a future where no one has to deal with this cancer. This chart just says it all, doesn't it? It shows you exactly what's at stake. Look, if it's caught at stage 1, the 5-year survival rate is over 90%. Amazing. But if it isn't found until stage 4, that number drops way down to less than 20%. Early detection isn't just a nice to have, it's everything. And honestly, this might be the most hopeful number in this entire explainer, because we can do even better than just finding it early. We have a tool that can stop the whole process before it even starts. The HPV vaccine. It can prevent up to 90% of the infections that cause cervical cancer in the first place. So the path forward is actually incredibly clear. It's a two-pronged attack, really. Number 1, vaccinate young people to prevent the infection from ever taking hold. And number 2, make sure adults get regular screenings to catch any precancerous changes that might pop up. You put those two strategies together, and they are just unbelievably powerful. And that leaves us with this one final, pretty amazing thought. Think about it. So many other cancers have these complex, mysterious causes, but with this one, we know what causes it. We know how to find it early, and we know how to prevent it. With the tools we have right now, today, eliminating cervical cancer isn't just some far-off dream. It's a real, achievable goal.